Imagine a world where even your health is invisible, simply because no one ever counted you. Black women are 3 to 4 times more likely to die from pregnancy-related causes compared to white women in the United States. Yet, until recently, most major national data sets didn't even break down maternal outcomes by race. Think about that for a moment. The true scale of who was dying and why remain hidden. Data deserts aren't accidental. They result from systems that decide who matters and who doesn't. But what if I told you that these numbers, the very foundation of our public health systems, are built on incomplete, biased, and sometimes dangerously flawed information? What if the data is telling only part of the story, leaving out entire populations? When these individuals are not counted, their health problems do not officially exist. Their suffering is rendered invisible, their needs are ignored, and the system designed to protect them fails them completely. They have no formal address, no legal status, no access to basic services. When a health surveyor comes to the neighborhood, their dwelling is overlooked. It doesn't appear on any official map. For all statistical purposes, this family does not exist. AI can take the existing inequalities in our data and bake them into the automated systems of the future. The peril is that we will place our trust in these seemingly objective, intelligent systems. Without realizing they are perpetuating old prejudices, a child is born into a state of invisibility. They have no legal identity, which is the gateway to education, healthcare, and social protection. They are systematically undercounted, not out of malice, but because the systems themselves are just not built to see them. Technology is often hailed as the great equalizer, the tool that will lift the invisible into view. But what happens when artificial intelligence built on incomplete or biased data becomes the new gatekeeper? As we rely more and more on data-driven systems, the invisible millions risk falling even further into the shadows. The promise of AI is powerful, but without a commitment to more inclusive, accurate data, that promise will remain out of reach for those who need it most. A stark reminder that when we fail to count someone, we are denying their humanity. The system sees the symptom, but it never sees the man. An AI-driven public health model might even recommend closing the distant, underused clinic. The logic of the machine would further strip resources from the areas that need them most. Technology will not be a savior. It will simply be a more efficient way of forgetting. The core of the problem is a simple, yet devastating domino effect. Use satellite imagery and a global network of volunteers to literally put forgotten communities on the map. When people are involved in the process of being counted, they gain a sense of agency. It is a fight for the principle that every human life has equal value. Counting everyone is not merely a technical challenge. It is a moral imperative. It is the ultimate measure of our humanity and our commitment to justice. The right to health is a universal human right, not a privilege reserved for those who are easy to count. It is the spark that can ignite the movement. We are all architects of tomorrow. The future of public health is not something that will happen to us. It is something we will build together through our choices, our actions, storytelling, peer-to-peer interviews, community-led surveys. These approaches honor lived experience, foster trust, and create space for voices that have long been silenced. As we reach the end of this journey, one thing is clear. Data is never just numbers. It's the heartbeat of communities, the stories of individuals, the foundation for a more just world. If we don't count people, they don't count, but they should.